Common things in sleep medicine. Number one, obstructive sleep apnea is very common, and we need some sort of sleep testing done. Now, we can do home test if appropriate with your physician. We can do what we call in-lab polysomnography testing. And now this is in-lab attended, so meaning you come into the sleep lab and just like this on bedding with assessments for breathing, predominantly breathing. And what we're looking for is times you stop breathing. Now, some of these symptoms, by the way, can be perceived like snoring, sometimes gasping. Sometimes people will see you stop breathing in your sleep. And certainly the more common symptoms may be just daytime sleepiness. So any of those concerns, you want to talk to your doctor and perhaps get a sleep test if appropriate. And so a facility like this where you come into a pretty comfortable room, comfortable bed, the technician will spend a few minutes wiring you up. You will get a few sticky things on the scalp, a little tube in the nose just to monitor breathing, and even bands on the chest and abdomen to look for efforts of breathing. All this gets computed into, recorded on a computer, and then technicians review in the study and determine if you have obstructive sleep apnea or perhaps other types of sleep breathing problems. And all this will be reported, given to your physician or referring provider, who will look at it and go over it with you and determine what your best treatment course is. In general, we like to have patients see their physician to make sure sleep testing is appropriate. So absolutely, you want to discuss your symptoms with your physician or provider and determine that sleep testing is appropriate. So also included is a comprehensive sleep medicine evaluation. Now this includes meeting with the provider to talk to you about your sleep concerns. And so discuss those. In the sleep medicine, they're going to review problems with insomnia, for example, or causes of insomnia. Sometimes that's restless leg syndrome or some other cause that could be disrupting your sleep at night. And of course, they're going to be reviewing potential sleep apnea symptoms, and then also determination if sleep testing is appropriate. Now, perhaps there's other things that we should do before sleep testing, but certainly a lot of things that we need to do after sleep testing. For example, various treatments for treating obstructive sleep apnea. So that sometimes requires detailed attention by your provider, and certainly something that the sleep medicine specialist here can provide. For example, getting used to CPAP therapy. Not easy for everybody, and sometimes it requires a little bit of information or education, something here at the sleep clinic we offer. In addition, getting familiar with different styles or masks, sizes, and appropriate fit to make things more comfortable. Now, CPAP machines, if you're not familiar, also include comfort measures, means to make it more comfortable for people to get used to and use every night. So these are little nuances that our professionals here are quite familiar with, and we'll do our best to make things comfortable for you so you can use CPAP therapy every night.